and welcome to the second episode of Impact Insights, your quarterly updates on all things PS Kenya. I'm Jedida Chepkosgei and I'm thrilled to have you with us as we delve into the remarkable interventions aimed at enhancing the health and well-being of communities across Kenya. Let's dive in. Earlier this year, devastating floods swept across Kenya, affecting 30 counties and displacing nearly 47,000 households. In response, PS Kenya partnered with the Ministry of Health and the Nairobi County Government to support flood-affected communities. We donated over 240,000 water purification products to the Masinde Muliro camp in Mathare sub-county. For more details, here's Cheryl Ojero.
These supplies were presented by Dr. Magwen Njenga, PS Kenya CEO, to Honorable Mary Muthoni, Principal Secretary of the State Department for Public Health and Professional Standards, and was set to be distributed nationwide to bolster government efforts in mitigating the impacts of the floods.
A donation from PS Kenya on water purification products, because there are many high cases. We've seen cases of cholera being reported, and this is to support us access to clean and safe water in this country as you continue coordinating many partners in the disaster response.
Displaced individuals in overcrowded camps faced heightened risks of waterborne illnesses due to inadequate sanitation. PS Kenya's donation of water purification products aimed to address immediate needs while supporting long-term sustainable development goals, promoting a resilient and equitable future for all.
In a significant development in the fight against gender-based violence, PS Kenya has secured additional funding from the Embassy of Denmark. This support will bolster GBV shelters in 13 counties, offering crucial safe spaces and comprehensive services to survivors.
We realize that very many people, they were not able to mention a place where they could seek support and, support and rescue in case they were violated. Actually, at the start of the program, only 30% of the people, they were actually knowledgeable on where they can seek support in case they were violated. The shelter was like the missing link in terms of the GBV response, because a lot of work is going on within the health facilities, creating awareness in the communities. But then again, after people maybe have generated knowledge on where they can seek support, then the question arises, if somebody needs to be rescued, do we have safe shelters?
Turning to recent events, PS Kenya played an important role at the 7th RHNK Annual Scientific Conference, highlighting interventions like DESIP, Binti Shupavu, and Accelerate projects aimed at strengthening reproductive health for Kenya's youth. Fidel Castro has more.
PS Kenya's participation at the 7th RHNK Annual Scientific Conference underscored its commitment to enhancing reproductive health for young people in Kenya. DESIP, Binti Shupavu, and Accelerate programs were in the spotlight, showcasing innovative approaches to reproductive health education and services. These programs are designed to empower youth with the knowledge and resources they need for better health outcomes. Fidel Castro reporting.
On 6th June 2024, the leadership team of PS Kenya, including board members and senior executives, visited Narok County to witness the impact of projects such as DESIP, Accelerate, and A360. Cheryl Ojero provides further insights.
PS Kenya's leadership team recently made a significant visit to Narok County, underscoring the organization's ongoing commitment to enhancing health and well-being across the region. The visit focused on the 3 reproductive health projects, that is, DESIP, Accelerate, and the 360, which target family planning, reducing teenage pregnancy, and empowering young girls. During their visit, the leadership team interacted with local health promoters, healthcare workers, and beneficiaries, gathering valuable insights into the community's challenges and successes. They also met with the county health management team to discuss strategies for further improving health outcomes in the region.
We are very delighted as a department, and specifically as a unit, and we want to continue supporting you so that you can be able to continue supporting us. We talked about the community health promoters, and in the course of our discussion here, it has come out very clearly that we really need to empower our communities so that they can be able to decide what they want for themselves. We even talked about the teenage pregnancies, and we realized it just comes out of the way people live together at that lowest level.
One of the visit's highlights was the team's engagement with the community, which reinforced the critical role of community involvement in these interventions. The interaction provided an opportunity to assess the impact of these interventions and explore ways to enhance their effectiveness.
During their visit to Narok County, PS Kenya's leadership engaged with teenage girls participating in the Binti Shupavu project. These girls completed a 3-month hairdressing course and received a starter pack containing essential items to help kickstart their careers. Population Services Kenya has solidified a strategic partnership with Jacaranda Health through a newly signed Memorandum of Understanding. This MOU, represented by PS Kenya's CEO Dr. Margaret Njenga and Jacaranda Health's Co-Executive Director Cynthia Kahumbura, paves the way for enhanced cooperation in providing reproductive, maternal, newborn, child and adolescent health outcomes in Kenya. Elsewhere, PS Kenya successfully concluded its Vaccination Action Network project on April 25, 2024 in Njoro and Rongai sub-counties of Nakuru County. Originating as a response to the COVID-19 pandemic, the project evolved into comprehensive vaccination outreaches and impactful social behavior change campaigns, reaching over 15,000 individuals. Cheryl Odiero provides insights.
The Vaccination Action Network project achieved a significant milestone by fully vaccinating over 15,000 individuals, with a notable 54% female participation compared to 46% male participation. To ensure the sustainability of project outcomes beyond their conclusion, concerted efforts were made to strengthen health systems and community engagement mechanisms. Recognizing the importance of building local capacity, the VAN project focused on enhancing the skills and capabilities of healthcare workers in the 2 sub-counties through training and capacity building initiatives.
Still focusing on health sector collaborations, a recent meeting held by USAID Private Sector Engagement Program together with the Ministry of Health Private Sector Coordination Team highlighted key objectives and discussions aimed at strengthening private sector engagement in Kenya's healthcare system. Here are the details.
On the 7th June 2024, the USAID Private Sector Engagement Program met with the Private Sector Engagement Advisory Committee to discuss on ways of developing key public-private collaboration strategies in the health sector and beyond.
We are going to discuss on how we are going to work together for us to bring the indicators, especially now for myself. I know in maternal health, maternal mortalities are still stagnating, and it is a big question for me and for everybody else.
That wraps up this episode of Impact Insights. Remember, at PS Kenya, we are dedicated to promoting better health and well-being across the country. Thank you for joining us, and don't forget to follow us on our social media platforms for the latest news and updates.